Man, that's much better, brother. I thought you trying to be incognito, bro.
Hello, everyone, and welcome. Thank you so much for being here today. We are here for our Interfaith panel on crisis care needs of faith communities. And so before I pass it over, I just want to go through some quick housekeeping items. So thank you so much for being here. I see Tanya, Leora. Hello, Kelly, Chioma, Herschel, Tamara. Thank you so much for being here. So first things first, if there's any technical issues that y'all run into, please feel free to drop it into the chat. We have our lovely C-Event host here, Kamal, to support you. Our chat box is closed to the audience, but open to our speakers. And so if you have any questions throughout this panel, please feel free to drop it into the chat. You can direct message me, and I'll be happy to pass that along to our panel. And just a reminder, everyone's microphones are off and the session is being recorded. And please remember to take the survey at the end of the session. That's how you can get your CEUs. And my last note is this training is offered through the CARE TA Center, the Crisis and Recovery Enhancement TA Center, which is funded by the California Department of Healthcare Services. And so the views and opinions expressed in this presentation do not reflect those of DHCS. And so with that, I will pass it over to our fantastic panel, and thank you all so much for being here today. We're all so excited.
Thank you so very much, Kiana. Good afternoon, everyone. I am Reverend Najuma Smith Pollard. I'm the program manager for the Cecil Murray Center for Community Engagement, as well as the proud pastor of Word of Encouragement Church here in Los Angeles, and one of the members of Clergy for Black Lives. I'm excited today to moderate this wonderful panel of dynamic faith leaders, all of whom are doing the work of crises response and management and care. And so when we thought about this panel, I knew the right people to bring along for this robust conversation. So the beauty of today's panel is that you're really just going to be listening in on a bunch of co-laborers and friends who work together often here in Southern California and Los Angeles primarily, and how we address this issue of crises continuum, anti-racist crisis continuum of care, and the work that each and every person here is doing individually, but also a lot of work we're doing collectively. And so thank you for being with us today. And one of the things that we recognize is that faith leaders play a critical role in this effective work, right? And so this is the right panel and the right discussion for us to be a part of. We know that faith leaders are often first responders, and not just to disasters like storms and earthquakes, but also to things like COVID-19, civil rights issues, police involved killings, racist attacks on all communities. We're often those first responders, and the list can go on and on and on. And so we're here today to share from our perspective, but also to dialogue about how we do this work. And our goal at the end is to leave all of you that have joined us today with some food for thought and ways in which you can continue to serve in the communities in which you worship, work, and live. And so I want to first briefly introduce all of our panelists. They are all, again, just awesome individuals in their own right. So they come to this space very well trained and versed. First, I want to introduce Marguerite Hill. She's the co-founder and executive director of Muslim Anti-Racism Collaborative, Muslim ARC, a human rights education organization, and co-founder of Black Muslim COVID Coalition. She also was the freelance writer who wrote How We Fight White Supremacy, that was featured in the LA Times, Huffington Post, and Al Jazeera English. And if you go to the speakers list, you can see more of her wonderful bio. Also joining us on the panel is Pastor Eddie Anderson. He is an activist and ordained pastor, and he currently serves as the proud pastor of the historic McCarty Memorial Church in Los Angeles. He serves as organizer with LA Voice, co-organizer for Trust Talks LA, and is an advocate for BLM, Black Lives Matter, and also we work together with Clergy for Black Lives. In addition, we have Pastor Kelvin Sauls. He is born and raised from Cliptown in South Johannesburg. I'm sorry, the south side of Johannesburg in the Republic of South Africa. And just a compassionate, courageous, collaborative, catalyst, visionary leader for positive and transformative change in the areas of racial justice, economic equity, gender equality, environmental restoration, and so much more. He also works with us with Clergy for Black Lives, and you'll hear more about his work in his podcast, Faith Without Borders. And then next we have my other good friend, Pastor Q Jean-Marie, and he is the pastor of the Road Church here in downtown Los Angeles on Skid Row, Literary Hatch Church on Skid Row. He's also leads with Black Lives Matter LA, and also works with us on, or we work together with Clergy for Black Lives, and then also serves on the board for CLUE, Clergy and Laity United for Economic Justice. And last but certainly not least is my friend, Reverend Haypen M. She is the president and founder of Faith and Community Empowerment. Acronym is FACE, a national nonprofit involved in empowering churches and nonprofits to leverage their resources by building capacity, leadership, and partnership in economic development, and serving as a bridge between the Asian American community and the greater community in Los Angeles. And she does so much more work, and we'll hear about that as well. So our panel was charged to look at three important kind of prompts or questions that each of our panelists will share from, and then we will dialogue a little bit more. So the first kind of prompt was around describing specific types of behavioral health crises we're seeing in our faith communities and what racial or ethnic behavioral health disparities we are seeing in 2020 and into 2021. Also, describe behavioral health providers, what could best align with our ministries and the people experiencing behavioral health crises. And then last and certainly not least, please describe recommendations for faith leaders to address racism in faith communities and the community at large. And so with that, I'm going to ask each of the panelists, they'll share briefly for about 7 minutes, and then we'll get into our conversation. So I'd like to first talk with you, Marguerite, and then we'll go through all of our panelists. Please feel free to share from your perspective on those three prompts and anything additional that you're being led for this moment. Thank you.
Thank you. Thank you so much. It's definitely a pleasure to be here, and I'll just try to dive right in. I mean, because I'm super humbled and honored to be amongst clergy and organizers who I completely have absolute respect for. You do amazing work. I'll share two pandemic stories, right? As someone who has community organizing training, and I consider myself like a baby organizer as far as like trying to build within my own faith community and with allies on doing kind of this intersectional anti-racism. We totally rely upon storytelling, and that's how we kind of connect heart to heart, and we can just strengthen our movement and through our connections together. So I'll start with, even before I begin the story, is just as a kind of question that just came up. It's, what do we do when somebody's drowning, but we can't get there fast enough? And that leads me to think about a story in the beginning of the pandemic, even like a month before it reached our shores, right? A month before, when we were still in the middle of confusion. Does a mask work? I mean, we were getting a lot of mixed messages, right? It was a really confusing time. We were told sometimes, like, if you put on a mask, that you would actually it would get worse, right? Because you'd be recycling the stale air. A lot of mixed messages from our administration. But just thinking back to what we could do when we can't get there fast enough, and how we can throw a line, it brings me to a story that I became connected to, and a woman I became connected to who was actually living in Wuhan, China at the time. I was watching the news stories at the time, and I actually didn't know anybody that lived there. And around late January, I started to see tweets from a travel writer that I loved. I loved her work because of as a Black Muslim woman who lived abroad, there's all these interesting instances. And I've also had been stranded at one point. I was stranded abroad, and some of that had to do with like race, class dynamics, and not having the funding to get back or get to my full destination. And so when I saw her tweets around being stranded, she had gone with her young family. So she had a 3-year-old son and a husband who was actually, he got a coaching job in Wuhan, China. And they went on a vacation for the Lunar New Year, and she couldn't get back in. And the whole city, the whole region had shut down. And so frantically, she was trying to relocate. She had to give up everything that she had. And through that, then her husband, they were definitely problem solvers. They went and he secured another job with another team in Europe. And so she was actually separated from her son and her husband while trying to get back. And England shut down. The US, she couldn't get back to the US. She couldn't move them back. And so what could we do as people in her own community and her network? What could we do to get her safely connected to her husband and young son? I followed each day with deep anxiety, but also deep empathy as someone who had been stuck, who was impacted by the pandemic in this profound way. And, she did hustle. She sold some of her books. We cash apped. We did what we could. And eventually she was able to reunite, but it was harrowing. It took weeks and it took a long time. And you could find more about her story. Her name is Imani Bashir. And I'm just sharing that because that's the kind of way that faith communities, we do connect. We see another Muslim, right? We see, and we, through word of mouth, like I had to try to find ways, can I crowdfund? How can we get her through? Like, how can we, secure her entry back to the United States? How could we make sure she wasn't homeless in the UK? And those were the types of crises that not just faith leaders, but regular people that are moms like myself, who will go to our imams, will go to our community leaders to try to address those crises. So, she was just one story out of many. During this time, there was also the Muslim ban, the Muslim African ban, because there was several African nations that were banned from this country. And so the COVID exacerbated the ban, the family separation, and it made it very difficult. And these were the types of crises that our faith leaders, our masajid, which those are the name, like, we have temples, we have churches, and Muslims, we call our place the masjid, which means a place of prostration. And many social services go through the masjid, but there's also informal networks. So that was an individual story where I tried to scramble and help. And whatever little bit that I did, many others we pulled together and we supported, but it was mainly through this young woman's effort and her family to come together, which showed resilience. But on a professional level, the question I had to ask is, what do we do when we as professionals, we see trouble on the horizon? And, and it was during that moment, and I'm sure we all felt that. We were waiting to try to figure out what was going to happen, what was going to happen with our organizations. And at the time, Muslim Mark, we had a 2-day training. It was a Muslim anti-racism training in SoCal. We called it the SoCal Muslim Anti-Racism Training. It was supposed to go from March 14th and March 15th. And a few days before, 3 of my trainers coming from out of state, they expressed their concerns. They said, look, we have family members that are immunocompromised and we can't make it. And we're a tiny nonprofit with a very big mission. We got big hearts, a big mission. And, so those tickets were really expensive. We were really stressed out, but I had to say, your emotional safety, your well-being as individuals, it trumps all of this, the need for this financial security or for us to put on this conference. We'll figure out something. And then the day or two before, the Shura Council, which is the umbrella organization for Muslims, they had talked with some of the doctors. And mind you, there's a lot of rumors at this time, a lot of us, we didn't know, like, can Black people get it? There was even guy like we raised that question because we didn't know if anybody. And we're like, when we saw a few of the basketball players, we, even some of those questions was like, well, we don't see Africans get it. So what's happening there? But we had to decide to cancel this event, and it was a costly, we had to take that hit, and across the community in Southern California, and then and in other places across the state, they had to decide, we are going to shut down our congregational prayers. Now that was on the 19th, like on the 13th, from the 12th to 13th, we made that decision. By the 19th, well, we found that there was many vaccine deniers. Like there's a lot of vaccine, like not vaccine hesitancy. There was a lot of denial about what was happening, right? Vaccine hesitancy, that's going to be another issue we're going to have to deal with, because it is still a problem. So at the time around the 19th, we had signed on to a letter and helped develop a statement that encouraged all masajid across the country to stop, to shelter in place, and to end the communal obligation of gathering together in prayers. And that was a very difficult thing. We had to have scholars to approve this, right? There was so many debates on theology, right? On the obligations of faith, that would this actually hurt us, would this hurt us as a community? But we had physicians, we had scholars, and together we issued that statement. But at the conference line, like as we gathered together with these national organizations, mind you, that what we noticed was that even though Muslim Americans are the most racially diverse religious community, there was a lack of representation on a national level of Black Muslims. Black Muslims make about 28% of American Muslims. And at the time, I was Dr. Camilla Mutman Rashad, who leads Muslim Wellness Foundation, she reached out to me, and she had just read The Psychology of Pandemics. And she described the behavioral health issues and community needs during each of the stages of the pandemic, from early pandemic, later pandemic, and the post-pandemic recovery. And she told me, Black people are going to die from this. Like, this is going to be bad. It's going to be really bad. And we have to do something. And so that weekend of the 19th, we planned, and together we came up with a blueprint for trauma-informed community organizing. In the statement, we wrote that marginalized communities are facing disproportionate economic and social impact of the pandemic. Black Muslims are disproportionately impacted by the COVID crisis due to several specific factors, including food insecurity in rural and urban areas, health disparities, political disenfranchisement, disproportionate incarceration, underemployment, and a significant elderly population. That made our community even more vulnerable. And so on the 23rd of March, we launched our education campaigns trying to alert our community, because we saw that there was a need for cultural ambassadors, people that they could trust, who looked like them, who understood our culture, who understood even the distrust of the medical establishment, from the Tuskegee experiment to other factors that had really targeted Black communities. And so we launched those campaigns, knowing that, with those concerns, and unfortunately, some of those predictions, they have played out. And even within Muslim communities in the UK, where they collect more religious data than we have in the US, that the rates of death is twice as much in Muslim communities, and Black Muslim communities likewise, like where we can, the numbers are pretty much on par with the mortality rates of Black people in general. So what do we do when we see trouble on the horizon? We have to plan. We have to have faith. We have to plan for the worst, right? And we have to understand the psychology of pandemics and the ways that we can both dissuade, dispel misinformation, and work to build a stronger and resilient community.
Wow. Thank you, Marguerite, for that. That was wonderful. And I appreciate how you began with, what do you do when you see someone drowning, right? Like, how do we respond to that? And that's really why faithers are called first responders, because we're often the first ones called. And thank you for just sharing from a Muslim American perspective, just how this crisis played out and some consideration about what we need to do going forward. Pastor Eddie, I want to bring you in, and if you could share with us around the same prompts around, specific types of behavioral healthcare crises that you're seeing in your community. How can providers best align with our ministries and the work that we're doing, but also any recommendations that you may have for faith leaders.
Wonderful, and glad to be here with you all. I'll keep mine brief and try to be to the point. So I'll say, first, I want to acknowledge that we are in, California reopened up, but we're still in the middle of a pandemic. And so for Black folks, we find ourselves in an interesting time, right? Between, a couple of weeks ago, we was remembering the massacre in Tulsa. And on Friday and Saturday, there'll be a bunch of Black folks remembering the delayed freedom. So between massacre and delayed freedom, and I think that's where our country is as well, is between massacre and delayed freedom. And so when you talk about behavioral things, you have to realize that as one writer wrote in my grandmother's hands, that Black bodies carry trauma. They hold the trauma. And the pandemic just exacerbated the trauma. And that's what I've noticed in my community, that the pandemic has exacerbated the trauma that Black folks and people of faith, my congregation is in a predominantly Black community, but it is surrounded by our Latinx sisters and brothers. And the trauma has been exacerbated, and the lack of trust was already there has been broken. And so a couple of things that I've noticed behaviorally is one, that the situation of isolation is very much a real problem. And the stigma of therapy was already there for a lot of people in the Black and brown communities. But isolation exacerbated it, and then you weren't able to see your friends. You weren't able to have the therapy that you normally had, which was therapy going to the barber shop, therapy going to the beauty salon, therapy going to your local corner store and talking to your person, or going to your local bar. That's how a lot of Black and brown folks found therapy, coming to the church and sitting with the pastor and being able to talk to the pastor. Those things were taken away. And so what I've seen is that for elderly folks in the community, their health conditions sped up. And so their decline health-wise increased a bit. What I saw for folks who were already on their last leg trying to figure out how to survive with their money, I have a story of a member of my current congregation who was a grandmother and a foster mom to her grandkids, working multiple jobs, trying to make it happen. Pandemic happens and money dries up. She comes to me and says, Pastor, I need a therapist for my teenagers because they can't go to school, and so they need help. I need housing vouchers because we got to find a better place to live. We're going to be locked up in the house. We already live in a 2-bedroom apartment with 5 kids, so this ain't going to work, Pastor. And then, Pastor, we need food, right? And so what did that mean for ministry and crisis? I mean, we had to pivot, right? So our church automatically, we shut down. But we started pivoting. And so we said, you can't nourish the mind of some people, you haven't first nourished the body. And so that's informed trauma, right? And so we fed over 10,000 people during the pandemic, right? We want to make sure you had sustenance and food. And then we try to make sure the moratorium, people had information that brings them a peace of mind. So that's one thing that I noticed throughout something I noticed about the pandemic. Another thing I noticed was houselessness. It was already a major issue, right? Houselessness is already a major issue, especially for Black and brown folks. We're 8% of the population, and I'll let Pastor Q tell you how it's going down on Skid Row. I won't go all the way there, but it was exacerbated, and people were concerned that they weren't able to pay their housing. And then what we have to also realize that those financial pressures did not go away with California opening up. It only made it worse, right? Because what we did was we did sharecropper mentality. We said, you don't got the money now, we'll put it off later and the moratorium will lift. Well, this is what my congregation said. They said, Pastor, I don't got the money now. I'm not going to have it 6 months from now or a year from now when they come and ask me for it. The church got the money? And I said, the church ain't got money either. We trying to struggle to survive as well. So the economic pressures are there. And so making sure the isolation factor was very, very big and help people get through that. And then also relationships, right? I saw in my congregation and around the community, relationships took a hit, right? I don't know the statistics on it, and they'll probably do the survey, but divorce has gone up. You know, families in abusive situations, you were stuck in your house with your abuser for a long period of time, right? Those are real situations that come to the front door of faith communities. And so the question is, how do we help people heal, to understand where they are at and understand that some of their triggers during this time period, especially with Breonna Taylor, George Floyd, our sister and the 15-year-old who gets shot in her front yard from a fight. Those things triggered the somatic response of a lot of African Americans as well, and exacerbated the pain. So these are all things as clinicians and therapists we have to lean in on, right? Not walk away from, but ask people questions, not so much of how you are feeling, but what happened to you during the pandemic is a question you can ask. Or you lost your loved one and the grief is still there. I have tons of members who lost loved ones that couldn't do the ritual around grief that usually happens when someone passes away. They weren't able to go watch them, be with them as they transition. They weren't able to have a proper funeral. I don't know how many families I've done funerals for where you got to be socially distanced. Nobody gets to the casket, got to keep your mask on, can't sing the songs you normally sing. That grief is still there. So the question then becomes, and where does that grief reside for you? Where do you feel that, right? And let's work through what that means and what closure could possibly look like. These are all questions that have risen to the top. And so when we talk about racism, we still between massacre and delayed freedom, right? And so racism is a part of our thing. So all clinicians and faith leaders know that if you want to heal yourself from something, you gotta just admit it first. And so when we talk about racism, it's okay for us to say, as a pastor, I tell people, if I don't know the answer, I'm gonna find someone who does. I don't know that experience as well. I'll refer you. And so what does that look like now that we've opened up the world and we've seen that racism has always existed, it's always here. And now it is sitting not only in our house, but it's in the streets, it's in your body, and we have to find a way to get through it as well. I'll turn it over and back to you, Reverend Juma, and I look forward to the conversation.
Yeah, wow, Pastor Eddie, thank you. That between massacre and delayed freedom, that's an essay, sir, that you probably need to write. But powerful way to frame the times that we're in and how they feel and look. And I like the question, and I would invite everyone that's joining us today to put that question in your arsenal when you check on folks, is what happened to you during the pandemic? What happened to you? And what's happening to you? Because like to your point, Pastor A, the pandemic is not over. We're still in it. They've just opened up our state, but we still have the issue at hand. And so thank you for that, Pastor Eddie. I want to move now to Pastor Kelvin Sauls. I want to invite you, sir, to share with us along these same prompts about specific types of behavioral health crises that you saw or seen. How can providers best align with ministries, and then maybe even some recommendations you might have for faith leaders going forward. Thank you. You have to unmute, Pastor. Oh, okay.
Can you hear me now? That reminds me of the Verizon commercial, huh? Can you hear me now? Can you hear me now? Anyway, glad to be here. Thanks for the honor of being, with, my esteemed colleagues and friends and, meeting new friends. Appreciate this opportunity to share around this. I think I want to start off by just, saying that one thing that we have to realize, around the crisis that we're dealing with, as well as behavioral health and all its connecting points, is that there was an epidemic before the pandemic. Not to recognize that is to undermine, really the impact of how this pandemic adversely affected, Black, Indigenous people of color. So I think that's very, very important for us to realize. And how do I know that there was a epidemic? I work in South Los Angeles, and in so many ways, connect South Los Angeles with South Johannesburg. So of course, I was watching this pandemic, in terms of how it's playing out, in on two continents, in two countries, and in two communities. And I have to say to you that it wasn't, that different, which was very, very interesting around that, because in the land of my birth, there was an epidemic before the pandemic, you see, around that. And so as, we were being prepared for this, what I did was, we convened all of our community partners, together as part of a program called Healthy Kids Zone, in the Broadway, Manchester area of Los Angeles, right around Fremont High School. And we began to ask, folk, well, what are you feeling? What are you thinking, around how this will impact you and affect you? So I think that's the number one principle I'd like to lift up when it comes to, how do I see behavioral, health crisis ease? We've got to trust people at the grassroots. That's very, very important, around that. And so as we were doing that, folk then listed, the challenges that they were seeing on the horizon. Of course, houselessness, was, one. Education was two. Food was, number one. And then, of course, safety. It's very interesting that the ones that they mentioned were all what we call long-standing drivers of disparity in South Los Angeles. So we cannot, one thing we do in the United States is we try to isolate a social political incident and not connect it with, with what happened before and what could happen afterwards. I think that the United States, or folk in the Western world, they have a great way of doing that. So when we see the knee on the neck of George Floyd, we think that that's an incident in, you see, Minneapolis, right? Whereas that is, that's a culmination of incidences that's been taking place since 1619, right? Let's just be clear about that. So I think it's important we make those connections. And so as food security then, got to the top, we then realized that, but, South LA has been a food desert, right? Since after the 92 riots, and that was one of the drivers of, the space that was mentioned there around safety, over policing, under investment, right? Education, the big concern, of course, was, the digital divide, right? That was, identified as a drive of insecurity. And then, of course, the housing piece. And so we then started organizing, and the organizing that we do is very asset-based. While the city was saying social distance, we really rejected that word because it was a very, for me, a word that was culturally insensitive to BIPOC, because we are social beings. And so we started using the term physical distancing, around that, because it gave this impression, as Pastor Eddie, mentioned, that now folk got to isolate themselves and stay away from each other. And so we worked through that. So we started to organize around food access, because we recognize that whole piece around food equity. And that was a huge challenge for us. I mean, people said, we will go hungry. We will starve. And so we started just pulling together, a grab and go piece, with physical distance, honoring all the 3 W's: wash your hands, wash your distance, wear your mask. We even handed out masks because a lot of people didn't have access to masks. So that was a real piece around it. But that was not, Pastor Juju, that was not what the pandemic brought upon us. That was the epidemic before the pandemic. So the pandemic shows up, and now we've had the epidemic of structural racism. We've had the epidemic of, health inequity. So the pandemic shows up, you see, and it just exacerbated that. And so we then had to deal with, okay, how now do we facilitate access to testing? Because testing sites went up on the west side before they went up on the south side. You see, I'm glad that the first testing site on the south side was at a church, right? Crenshaw Christian Center, on Vermont, in terms of that. And so we then organized around that. So I think it's very important, that we realize what really we saw in that community. It's what's been there, and now COVID-19 has just uncovered it all. In terms of working with providers, let me just lift up a couple of pieces, 3 T's for you. The first one is trust. The second one is truth. And the third one is transformation. When I work with providers, I share with them, you need to be trustworthy for people. And you become trustworthy when you tell people the truth, right? And when you tell people the truth and you listen to them, you'll be amazed at the mutual transformation that will take place. Let the work that you are doing be trauma-informed, be culturally competent, and understand the power of proximity, in terms of that. You got to be where the people are to be able to impact the behavioral health crisis that people, are looking at in terms of that. And so to other faith leaders, I say to them, you don't need to be an expert, have a deep and wide referral system as you deal with challenges of depression, as you deal with mental health challenges, as you deal with suicide challenges and all of these issues. So I'm appreciative of the depth and the breadth of that referral system that then connects me with so many other folk to be able to call on them, bring them in so that we can, address really the needs of the community as we seek to move it, towards a more just and fair, South LA. I'll stop there and I'm looking for the conversation.
Thank you, Pastor Kelvin Sauls, so very much for framing the trust, the trust, the truth, and then the transformation. But that epidemic before the pandemic, I hope you also will write an essay on that. I'm seeing all these essay titles, and just how what the pandemic, it didn't bring anything new to our communities, but exacerbated what already was there. And if we're actually going to thrive, what I'm hearing is, and from each of you so far, if we're actually going to thrive through this pandemic and after, if there will be ever after, is we have to address these long-standing drivers of disparity that have pre-existed the pandemic, and framing it just the truthful way. There was an epidemic before the pandemic, and which also is important because what can happen is we can think because they've opened California back up, the pandemic is gone. The pandemic may be coming to a close, but the epidemic is still here. The pandemic may be coming to a quote unquote end or close, if you want to say it that way, but those epidemics, they're still among us. So we have to address those. So thank you for that, Pastor Kelvin Sauls.
Absolutely.
Yeah. Let's bring in Pastor Q from the Road Church. If you could share also on those 3 prompts, we'd love to hear from you, sir.
Well, first of all, thanks for doing me the dishonor of having me go after the African Prince, Reverend Sauls. But I'm never worthy to sit with folks who are, I consider, way more educated than me in this work. That said, being the pastor of the church without walls for 15 years in Skid Row, I had a street education as it relates to trauma. I love Pastor Saul's framing. There was an epidemic before the pandemic. I love that because what I saw was prior to COVID-19 for the past 15 years was people defecating in the streets. The UN, and what hurt me more was to see Black women pulling their underclothes down in the streets, even while I'm preaching, and doing what they have to do. And then the United Nations came to Skid Row. I'm talking about an epidemic before the pandemic. Thank you, Reverend Saul. UN came to Skid Row twice in 2019, I think between 2019, 2018, 2019, and indicated that there was more restroom access in a Syrian refugee camp than in Skid Row. Not that a Syrian refugee camp is not worthy of restrooms, because certainly they are.
Pastor Q, I'm gonna need you to run that back. Say that one more time.
Yeah. The United Nations came to Skid Row and said that a Syrian refugee camp has more restroom access than Skid Row. And I say that not that a Syrian refugee camp does not deserve restroom access. They deserve restroom access as much as they are human. In 2018, California went from the 6th largest economy in the world to the 5th largest economy in the world. Just to give you context, there was an epidemic prior to the pandemic. We know that in 1933, we were faced with a housing shortage when the federal government began to explicitly to increase and segregate American housing stock. There's an author by the name of Richard Rothstein who says housing programs began under the New Deal to a state-sponsored segregation system. And so the housing crisis began there in 1933. We know that in 1942, I'm going to talk about trauma in context. I'm going to link this to trauma for you. So we know in 1942, when our Japanese sisters and brothers were unjustly evicted from their homes in Little Tokyo by the same system that was lynching over 1 million Black folks migrating in the Second Great Migration from the South all the way to the West and the North, moving into a place called South Central. So when South Central, because Central Avenue ran from South Central to Little Tokyo. So when Japanese were unjustly evicted by the same system, I'm talking about trauma here, y'all. Black folks began to migrate down Central Avenue into Little Tokyo. Little Tokyo became known as Bronzeville. Between 1st and 5th Street, jazz emerged. Come on, somebody, here in Los Angeles.
Exactly.
I'm talking about trauma, y'all. I'm talking about how far the trauma goes on.
Yes, sir.
Well, it's Juneteenth coming up, and we know that in June 19th, 1865, that's where the houselessness began, because we know that there were many Black folks who were not housed in 1865 when they were set free. We always try to, when we talk about American issues, we don't do critical race theory, in that we don't look at how the system has caused the issues. I'm talking about Syrian refugee camp. I'm talking about Skid Row. I'm talking about watching Black women and Black men defecate in the street. But the restroom access is the problem. And so people become conditioned to a particular way to live and survive. I didn't come to preach today, but excuse me if I do a little bit of it.
Yes, sir,
right?
Doc.
I love Dr. Samaj Jabbar, a psychiatrist and psychotherapist, a Palestinian. She says, the clinical definition of post-traumatic stress disorder do not apply to the experiences of Palestinians. PTSD better describe the experiences of an American soldier who goes to war to bomb and go back to safety in the United States. He is having nightmares and fears related to the battlefield, and his fears are imaginary. Whereas for the Palestinian in Gaza, whose home has been bombarded, the threat of having another bombardment is very real.
Yes, sir.
It's not imaginary, says Jabbar. There is no post because trauma is repetitive and ongoing and continuous. I'm talking about the Palestinian and the African-American experience, y'all.
Yes, sir. Yes, sir, Doc.
I
Connected,
think
connected.
we need to be authentic about our experiences, she said, and not try to impose on ourselves experiences that are not ours. Come on, somebody. Can I get it right on? So Black folks don't have post-traumatic syndrome, never did, never had it, never will.
Mm-hmm.
We have ongoing trauma like the Palestinian kid who could actually experience another bombing even as we speak. Can I get it right on?
Right on.
Absolutely.
And trust me, I could go on. I could go on and talk about the decolonizing of our healthcare. But I'm gonna stop right there just to give you a little something to think about.
Wow. Pastor Q, sir. How you gonna break it down like that?
Break it down.
What I'm hearing you teach us this afternoon is that the trauma ain't post, it's present.
It's ongoing.
It's ongoing.
It's now.
It ain't post.
We talk about Jesus being the same today and forever. Our trauma has always been the same yesterday, today, and forever.
Yes, sir. Mm-hmm.
Wow. Thank you for that. Claynisha says, I'm gonna need my edges back, Pastor Q. I think you just really busted something wide open for all of us as we understand it's not post-traumatic. It is ongoing and repetitive, and there's a constant state. All of us are expressing that is that epidemic before the pandemic, but we've all been experiencing it, are experiencing, and there ain't no really much hope that we're not gonna experience it. Yes, another essay, absolutely, absolutely. Haypen M, Reverend Haypen M, founder of Faith. Please jump in and let's hear from you. And I know that you have something very powerful to share as relates to these 3 prompts. And then as soon as Haypen's done, I want to just throw a couple of questions at a few questions at you all, and then we'll take our Q&A.
Good afternoon, everyone. Again, thank you so much. This has been a very powerful session. I want to say for the Asian American community, this past year has been wrought with just much pain. And we've been hit with perhaps 2 viruses, the coronavirus as well as the anti-Asian hate virus as well. And I think just, again, I'm very honored to be included in this space. I think the experience of Asians throughout history, in particular in the United States, is the fact that we continue to be, I don't know the word, omitted or overlooked. And the model minority myth seems to rob us of the solidarity with other communities of color. As well as then resources that could also advance our community. So during this pandemic, I have to say that because of the connection with China, it wasn't just the Chinese community, but really all Asian community. And the other day was some Hispanic older lady who was mistaken for Asian, and she got totally assaulted as well. But bottom line, it doesn't matter what Asian you are, all communities do get impacted. And there's been over 6,600 incidents of hate that have been reported. And I have to say there's a lot more. And historically, that is not new. But I think, and I'm grateful for the social media platform and also the allies, as well as many of us who are Asians that have come of age and are in places of influence, such as the media, that some of this pain is finally starting to be elevated. And so for that, we're very grateful. I want to say that because of that connection with the Wuhan, the China connection, that many of the people just for whatever reason, lack of knowledge, just leaped in logic to say anyone who's Asian has the disease. And then also the Asian-owned restaurants also have the disease. And so people just stopped, visiting many of these restaurants. And so, which also, again, for many Asians, they are foreign born. And so they have language limitations. So they end up being employees of some of these family-owned ethnic businesses. So when the businesses closed, and initially there was over 230,000 plus businesses that just closed. So we've had such an economic hit, but even in the unemployment filings, right off in New York, where it was an epicenter, there were over 10,000% increase. And the next group was a 3,000% increase. So there was this huge jump. And even late as January of this year, Asians in New York had 500% increase, up the highest of any group. And then if you look at also people on the front line, workers as well as essential businesses, 1/4 of Asians are in like leisure, retail, like health, in all those things that where you can't go home, you can't stay in the safety of your home. And over 20% of doctors in this country are Asian, almost 10%, like a little over 9% of nurses are Asian. In California, actually, 25% of all healthcare workers are Asian, as one example. So, in terms of the disease as well as economic challenges, we've been hit really hard. And I know that there's over 20 groups, 20 countries, but almost 50 groups and 100 languages under this big umbrella of AAPI. And so in that way, I've just been in so many conversations where, again, when they aggregate the Asian data, it really hides and masks the subgroups in which many of them are at very similar or maybe at times even greater levels. And I bring that up, again, not so much for Oppression Olympics per se, but because we get eliminated from the discussion from the beginning, that without having to say, hey, we're on the same team, we're in the same boat, the systemic racism structure doesn't discriminate, right? Whoever has power is going to hang on to that power. And so really for my experience with the Asian community, some people say we're white adjacent, but really if you look at the CEOs, the C-suites, all those kind of things, it doesn't translate for many of us as well. So I just want to put that the trauma of constantly being told in so many ways we don't matter in this country. When we show up, we're not lifted up. When we have our pain, we're told that it's not important enough. All those things has been traumatic. And then for many of us, our home countries where we immigrate from, right? The immigration process itself is traumatic, but our home countries, our parents' generation have been laden with trauma of war, comfort women, and all the other things that have come this way as well. So I just want to lift that up. The second piece is that, I could kind of go on and on, but I know our time is cutting off. So I want to start off by saying that for the providers, please include the Asian community and please look closely and don't just look at the aggregate data, because that really is misleading. And so please do that and really look at the faith community. They do play such a significant role. They're the first responders, as others have mentioned. And in the Korean community, 75% are connected to churches. The third question I want to put out is that, how do we deal with racism? I think, again, it's lifting up truth. A lot of times that we tell myths about the other that perpetuate this impression and put them into this category of evil. And again, at the bottom line, I know that particularly I've learned from the Black community, when there are things that happen, right, to, not to just kind of judge the perpetrator per se, but to look at the whole system that perhaps have created an environment. And so even for like the Asian store owners and such, I know there's been traditionally some tension there to kind of, again, to be able to look closely at that context of what systems have made that happen. And then the last is that at bottom line, I think the naysayers are going to be always there.
Yeah.
But I take Susan Boyle with Britain's Got Talent. There were a lot of naysayers when she came on stage, but when she shined her light on that platform and with a little bit of mentorship, the world changed in terms of the way they could receive blessings from her and also how she can be blessed. And so, we run a leadership institute called C2 that trains and equips faith leaders to shine their light and to be able to engage in the public community, civic space, so that you're able to know where all those referrals that you could check into, right? So you're not doing it alone. God never did his work alone. And so again, as faith leaders, we need to be equipped how to work with others and bring that lifeline to the people.
Thank you, Hey Pen. You are marvelous. We're short on time, but listen, so much has been shared. So I'm gonna kind of go backwards. Hey Pen, what I hear you sharing with us, and I really like that you said systemic racism doesn't discriminate. And I want to encourage all of our panel, all of our faith leaders, and anybody that's watching, even providers, always ask the question, who's missing from the table? Who's missing? And I think it'll directly address one of the things that Hey Pen is lifting up, that the Asian community is often left out. Pastor Q reminded us that it's not post-traumatic trauma is repetitive and ongoing trauma for communities of color in this nation. And so please don't address it as if it just started happening in 2020. The epidemic has preceded the pandemic, as Pastor Sauls told us. And so we must always go back to the epidemics that have pre-existed the pandemic. We were reminded by Pastor Eddie to ask the question, what happened? What's happening to you, to find the answers? We were encouraged by Pastor Salt, by Marguerite Hill to be available to help those who are drowning, to run out and help those that are drowning. And so thank you, all of you, for allowing me to moderate this conversation. And we could literally be on for another 2 or 3 hours because all of you have so much power to offer. To those that are watching and all these attending the session, please go to the speaker page on this conference. Connect with each one of these leaders, call on them, use them, bring them into your organizations to speak, because they have so much to share and so much power. And this hour is really just scratching the surface to the depth of the work and the breadth of their impact here in Los Angeles and around Southern California and even across the nation. So thank you, CARE Conference, for having us. I got my 2-minute check, but that's okay because Dougie Fresh did it in 2 minutes and I can too. So again, I'm Pastor Najuma Smith Pollard, pastor of Word of Encouragement Church. I'm also director of the Cecil Murray Center for Community Engagement. Please make sure to continue these conversations and know that all of us have a responsibility in addressing some of these behavioral health challenges in the midst of crises. And we have the power to do so. And all of these panelists have shown us ways to look at these issues and then respond to them. And so thank you so very much. And thank you for joining us today. And Kayana, we are back in your hands. Ayana, I'm sorry.
Thank you. Thank you all so much. What a phenomenal panel. You are all magnificent. Thank you so much for being here. Last note for anyone in the audience, please don't forget the survey form to fill that out. We would be so appreciative to hear from you and hear what you thought of this panel and this overall conference, especially if you would like to get CEUs, that is required as well. So thank you all for coming and sharing the space today. And thank you to our phenomenal speakers for being here. Well, with that, we can go ahead and close out.
Thank you all so very much. Please make sure you follow all the panelists on social media after you do your survey. Follow all of these panelists. They're doing great work. Thank you, Pastor Q, Pastor Sauls, Reverend Hay Penn, Pastor Eddie.
Thanks, everyone. This was very enlightening and enjoyable.
Yes.
Looking forward to part 2 somewhere,
Yes.
somehow,
We're going to
soon.
figure it out. Absolutely. Thank you.
All right. Much love.
Appreciate you.
And Assalamu alaikum.
Walaikum salam.
Walaikum salam.